All right, so this is gonna be for scenario 1B. We had our patient here who's laying back behind me. They tripped and fell on a curb and they hurt their ankle. They were coming in anyways, so they figured they'd come in and get checked out. They're having some bruising and swelling and some palpable kind of like clicking, grinding crepitus going on kind of on the outside of their ankle and the lateral malleolus. So the first thing that I am going to do is check the scene, which we are at my clinic right now, so presumably it's pretty safe. And then we're just going to take a look at the patient's ankle. I can move this. So, I take your sock off.
Yeah.
Okay. So we're just kind of looking for any deformity, any sort of angulation, anything like that, which doesn't look like anything. He's having some pain on the outside of his ankle right here. So what we're gonna need for this, we're gonna splint it. So we're gonna be using our SAM splint, which I kind of cupped and made it into like a horseshoe. And we're gonna have some gauze as well. So first thing we're gonna be doing is we're gonna check vitals. So we're gonna find his posterior tibial pulse, which is on the medial malleolus back here. Feeling for his pulse back there. And then we're also going to check dorsalis pedis. Feeling for that. All right. And then Max, can you scrunch your toes? Perfect. And then we're going to do capillary refill, which is good. So that's great. Max, without looking, can you tell me what toe I'm holding?
The big toe.
Great. All right. So now we're going to move into splinting. So I'm just going to be taking this, the horseshoe, putting it around his heel, trying to keep his foot as it is because he's having some pain. Getting that right there. And I'm just going to take my gauze and we're going to start wrapping this up, stabilizing the splint. Going all the way down with this until we get to the bottom. So now that the patient has a splint on, his ankle is secure, we're going to check vitals and CMS again. So I kind of blocked the posterior tibial pulse, so I'm not able to do that, but I can still do dorsalis pedis right here. And then CMS, so squeezing the toe, looking for that capillary refill. Can you scrunch your toes, Max? All right, and then what toe am I grabbing?
The little one.
Great. So now that that's done, we are suspecting either a fracture of the distal fibula on this leg or like a sprain or a strain of the peroneals on that side as well.